Welcome to Techstination. Joining us is Cobi Gantz, co-founder and CEO of a company called Chapter. Thanks for joining us, Cobi.
Thanks for having me.
Well, Chapter is a company that serves as a Medicare advisors for the many, many seniors who have to make some choices in the coming days. Give us a little background and overview.
Yeah, thank you so much, Fred. We are a new type of Medicare advisor. And so we have fixed three key problems that have made Medicare really confusing and frankly, a terrible experience for most seniors. The first is that it's very challenging for people to search every plan option for which they are eligible, which means that people fundamentally have less choice than they should. The second is that most advisors recommend only the subset of plans that pay them. And the third is that the lack of technology makes it a terrible user experience for individuals. And so we've addressed each of those problems in turn to really create a new type of experience for people enrolling in Medicare.
So describe it for us. Step us through.
Yeah, so when an individual wants to learn about Medicare, they often have 50 plus options that are available to them. Those could be plans like Medicare Advantage, they could be Medicare Supplemental or Medigap plans, they could be prescription drug plans. And there are a host of options and implications that people have to understand and make choices about in terms of those trade-offs. For us, we ask a series of simple but discrete questions to help someone understand their choices and their trade-offs. And then we use that integrated data set that we have created by looking at every option in the country. And we recommend the plans that are best for the individual, regardless of the compensation that we may or may not earn from an insurance carrier. And then we match that individual with a licensed Medicare expert to really go through the options, and that's really important to us. So everyone has a tailored experience to them and can speak to a person instead of just a robot.
Well, describe for us why people who are making these choices should entrust you with it, because you are being paid by insurance companies like many other advisors are.
Like other advisors, we do get compensated by insurance carriers. That's correct. That allows us to provide the service at no cost to the consumer. Unlike other advisors, however, we don't let that compensation influence our recommendations, and we've structured ourselves in two ways to make sure that that's correct. The first is that we have no information about the commission or the compensation in our plan recommendation. So there's no way for us to actually recommend only the subset of plans that pay us, or to use those plans to influence our recommendation, to use that compensation potential to influence our recommendations. And the second is that our advisors don't have that information either. So our advisors aren't subconsciously pointing people to plans that earn higher commissions. So we often guide people to think about how they should think about speaking to an independent advisor and the questions they should ask people, because to your point, there are many independent advisors, and we're one of them, and we think that we offer a great service.
Now, if people use your service by going to getchapter.com, are they obligated to purchase the insurance through you, or how does it work?
Certainly not. There's no obligation. There's never any obligation to enroll with us or to enroll with any independent advisor, and it's free. So a lot of people come to us to just ask questions, and we are an independent, unbiased source of information, and that's great. We're more than happy to answer questions. It's very low stakes to speak with us.
And the choices, I guess, can vary from state to state, so you're able to localize things?
Yeah, there are different insurance regulations in each state, but there's also a host of commonalities across all states. And so we use our technology and the data that we've aggregated to really precisely recommend the plan that is best for the individual, taking into account a lot of those local factors, like what doctors are in network with which carriers, which health systems have better ratings, and really getting the local aspects to be tailored to the individual, because to your point, that is very important for many people. That being said, there are a lot of complexities with local markets and with everyone's individual situation. So what is best for one person or what may not be best for the next person, even if they live down the street. So that's something we really try to educate our customers about.
Well, it is a confusing time for people, especially with the bombardment in the mail and television commercials, etc., about making these choices. So, what is it that people should know, basically, about the importance of making this choice?
One of the reasons we started Chapter was because there are such perverse incentives in the market today. There's really bad advertising. It can be extremely confusing about who you can trust, and so that is one of the challenges that we've tried to address. I think there are three key things people should consider. One is that every year they should be reevaluating their Medicare choices. This is not a decision that should be made once every 5 years, which is unfortunately how most people address it today. The second is that people should speak with an independent advisor. There's no benefit to going directly to an insurance carrier, and independent advisors are there to guide people. And the third is that there are really challenging and important implications to every decision that's made when it comes to Medicare. And so speaking with someone who really knows their stuff and who is an expert is quite important.
Is some or a lot of the advertising that people see misleading in any way? Because very often you're going to get to free vision, dental, everything, and it's not going to cost you a penny thrown into your coverage here. Yeah,
there's the former NFL player who's telling you to get a $0 premium Medicare Advantage plan. It's really confusing and misleading. For some people, Medicare Advantage plans are a great option, but for many people, they're not. And that's really why we take this personalized approach to understand not just someone's doctors and prescriptions, which is how most Medicare advisors approach the Medicare plan recommendation process, but we take into account dozens of factors. People's doctors, their prescriptions, their risk preferences, their travel preferences, their lifestyle, their budget. And we try to take all these into account to really find the right option, not just within a Medicare Advantage subset of plans, but across the different plan options that one has. And of course, with any insurance product, there are trade-offs. And so if you're not going to pay any $0 premiums, there are going to be other ways that insurance carriers can cover their costs.
So tell us how you got into this, how and why.
When I was growing up, my grandfather lived with my parents and me, and I saw the challenges that he faced engaging with the modern tech-enabled world. He was mentally sharp, physically capable, but really relied on my parents and me for any outside engagement. One of the big challenges that he faced was enrolling in Medicare. My mom spent 3 full weeks calling different parties, different parts of the government, different private companies, different insurance carriers to try to understand what plan he should enroll in. And then I saw my parents go through the same thing for themselves last year. And they almost missed deadlines. The government penalizes individuals if they do not enroll at the right time. And when it all came out, they were actually on a plan that was paying them way more than they needed to pay for identical coverage that was available elsewhere. And so I started to look at the Medicare market and just try to understand it. And it was shocking how bad it is, both in terms of perverse incentives and in terms of technology. My background is working at a software company, and it just seemed insane to me that there was not better technology in this market. We can order a really fancy pizza on our phone in less than 3 minutes, but for consequential decisions like Medicare, you have to make dozens of phone calls over multiple weeks and fill out piles of paperwork, and that just didn't make sense to us. So that was the proximate motivation for starting Chapter. And more broadly, we want to address a host of challenges that are facing our aging population and for which there's been really no good technology built.
Terrific. Well, once again, the website is getchapter.com. Cobi Gantz, thank you for taking the time with us.
Thank you, Fred.
Now this. It takes a lot of listening to build a better radio, and that's just what the folks at C. Crane have done. Bob Crane and his crew, nestled among the rivers and tallest trees in the world in Fortuna, California, have made a habit of listening to their customers. And that's just what they've done in building the CC Skywave SSB, the Swiss Army knife of portable radios. For everyday listening to AM or FM in the yard or patio or on the nightstand without having to drain a mobile phone battery, it's a great companion. But it is also a companion equipped for NOAA weather information and alerts that can be life-saving. You can listen to FEMA and Coast Guard transmissions too. Beyond all of that, you can tune into shortwave signals from around the world. It's compact, easy to take with you, and built to last. The CC Skywave SSB. Click on the link at Techstination.com.